Hello, everyone. Thank you so much for joining us today. This is Inga Hansen, editor of Medesthetics magazine, and we're going to go ahead and get started with our webinar. Today, we will be discussing GlycoAla, a glycosphere-delivered photodynamic gel with hyaluronic acid that's indicated for skin rejuvenation. If you have any questions during the presentation, please type them into the question box on the right-hand side of your screen, and we will answer them at the end of the webinar. Our presenter today is Jagdeo, Associate Professor of Dermatology and Director of the Center for Photomedicine at SUNY Downstate Medical Center. He is also the founder of the Laser Aesthetics and Body Institute. Welcome, Dr. Jagdeo.
Thank you so much for having me. Hello, everybody. Welcome to the talk on GlycoAla, photodynamic gel. This is a really, really exciting product. I've had the pleasure of working with it personally and using it to treat patients, and also being well versed in the science of photodynamic therapy, and just loving different products that we can use and implement simply and efficiently and safely in our practices to benefit our patients and help them achieve their cosmetic goals. Without further ado, we're going to kind of turn this on over and focus on the star of the show, GlycoAla. GlycoAla is a cosmetic photodynamic gel with hyaluronic acid, and it's very special because what this is really the leading product on the market that combines the use of a topical product plus light-based therapy, hence the photodynamic aspect, to help make skin look its personal best. So, brief summary of ALA PDT. Photodynamic therapy is well known from a historical perspective for the use of non-melanoma skin cancers, and that's developed into a new clinical treatment modality that has really permeated skincare for the past 20 years. The combination of 5-ALA that is taken up into the skin by skin cells, usually epidermal cells, and that it becomes more photosensitive as it's incorporated into the cells, and as it goes through the porphyrin pathway, that 5-ALA gets converted to a photosensitizing agent known as protoporphyrin 9, PP9, and that gets activated by visible light. PDT is a non-invasive tissue-sparing modality with good cosmesis outcomes that preserves the tissue and has limited scarring potential. A study done and published in 2002 by Rodriguez demonstrated that ALA PDT is an effective treatment for both photorejuvenation and the treatment of precancerous lesions known as actinic keratoses. High concentrations of 5-ALA results in a lot of erythema, otherwise redness and swelling, and may have post-treatment complications. Low in 2005 demonstrated that lower amounts of 5-ALA, 5 to 10% range concentration, visibly reduced fine lines and sun damage with minimal erythema and minimal downtime. Now, I would just like to share from a personal standpoint, I work in New York City, I work in Brooklyn, which is like the epicenter of cool, and I have patients in Soho, and I treat these patients, and everybody wants the same thing. They want phenomenal outcomes with very limited downtime or no downtime. And that's one of the reasons why I'm so excited about GlycoAla, plus the combination with light to make photodynamic therapy for a cosmetic benefit, because what that really yields is kind of the golden paradigm of what most of our patients are asking for and looking for, which is a phenomenal outcome, limited downtime. So what is 5-aminolevulonic acid? Well, as we see here, we see the chemical structure here, and it's commonly referred to as 5-ALA. It's an endogenous non-protein amino acid. So that means that it's something that's naturally found in our bodies at a very, very low level. Usually it's very quickly metabolized into protoporphyrin 9 through the porphyrin pathway. The first compound in porphyrin synthesis pathway, as we have already mentioned, it's involved in the synthesis of heme, the heme that's found in hemoglobin. And higher concentrations of this 5-ALA is wonderful for destroying skin cancers and precancerous lesions. However, as we see here on the left, we see that these higher concentrations, 20% causes the most amount of redness, 10% a little less redness, but still erythema, 5% more moderate. And as we trend down in between the 5 and 0, it's really fading away. So you can have, efficacy without the redness if you lessen the concentration of the ALA. I just want to share with you these wonderful photos of possible side effects of ALA PDT. This is using the 20% Levulan from Sun Pharmaceuticals, which is now the new owner of DUSA. That, you see this gentleman, he's, probably around our age, somewhere between 30 and 39. So he has, some lesions on the face. He wants to look his best. But after undergoing this higher concentration of 5-ALA, Levulan, PDT, he has a lot more redness than we would anticipate. He gets a wonderful result, but by a week and a half out, 10 days, he's still a little red, still a little puffy. But by 30 days, he'll look phenomenal. One of the things that's really exciting is that we can use lower concentrations of 5-ALA to get great outcomes, but with less redness, with less downtime. Essentially, the golden paradigm of what our patients are seeking and what we want to deliver in our office so that we can help patients and that we can maximize the happiness that our patients get to experience from the treatments that we provide. So here we see a young lady, again, in that same age range, probably 25 to 39 range, the typical younger patient who wants to come in and says, I want to look better. I don't, I lead a busy life. I don't want to take off from work. I want to be able to just, put some, SPF powder on after my treatment, and I want to go out to dinner with my friends. And this is the perfect treatment in office, especially around the holiday time, when people are busy and they still want to have their cosmetic treatments done so that they can look their best, but they don't want to, be red for a week and a half. And, this is a photo showing immediately after a GlycoAla treatment that this patient looks just a little red, a little pink, but perfectly fine. You can cover this up with some powder and the patient can go out and continue her day. So common clinical ALA derivatives are, commonly found on the market in the US and in Europe are the following. So Metfits, which is distributed by Galderma/Photocure with the Actylite. I know that in the US, they're trying to bring this on over, hopefully within the next year or two, to be used as in conjunction with Daylight PDT. Those studies are ongoing right now. Metfits is registered in many countries for the treatment of AKs. It's sold as a 16% concentration cream, and 2 treatments are recommended, occlusion for 3 hours. Levulan Kerastic, this is registered in the US for AKs, 20% topical solution activated by the Blue U, and it's the first photosensitizer to actually achieve approval in the US. Biofrontera by Ameluz, this is a 10% gel of ALA containing a nanoemulsion, which is said to make the product more stable and hopefully give better tissue penetration and higher efficacy rates. Clinical trials were compared to Metfits, showed better efficacy. I think the head-to-head against DUSA's is almost similar. This really allows for a new product to really kind of be a star in our marketplace, because the products that I just shared with you are really 10% to 20% in that range. And there's nothing really in the United States that really fills the niche and the patient need and the desire to have cosmetic PDT performed in office and get great outcomes, but without the side effects. So that really allows for a new ALA, lower concentration for cosmetic applications. And what is so special and what really drives this beauty product is the encapsulated ALA. And what is so special about that? That allows for lower concentrations to be able to be used effectively with shorter incubation times and to still have the same mechanism of action to give great results, to give a photorejuvenated effect, to help with cosmesis. But again, it's non-pharmaceutical and it's being used for skin improvement. So what does this look like? This 5-ALA some of the problems and some of the solutions are as follows, that really the hydrophobic nature of PDT drugs means that they have poor solubility in water. That's why they're usually in a gel format, or that they may be in an alcohol base. This prevents optimal cellular uptake, and then nanomaterials such as nanoemulsions can significantly enhance the solubility of these photosensitizers in water and thus increase their cellular uptake. That is the innovative solution being used here. So Passos in 2013 demonstrated that an encapsulated 5-ALA had improved penetration and spread compared to methyl ALA. Organic nanomaterials for PDT, such as liposomes and polymeric nanoparticles, have achieved safe and controlled delivery of drugs by using these biodegradable and biocompatible materials and tailoring these chemical compositions of the materials. And so really that comes to our solution. These glycospheres, that's where we get the glyco in GlycoAla. That is the solution, that is the innovation. And so what happens here is just to make this very simple, is that the ALA gets encapsulated, surrounded by this lipid bilayer. And as we know, our cells and our skin really functions on this lipid and lipid bilayer concept. And this is what's so exciting, is that we're able to harvest and harness the technology of glyco encapsulation with this glycosphere, having this ALA in the center and allowing for this delivery system to really, allow for our patients to get the best outcomes with minimal downtime. And so what it does is it entraps the molecules inside, making it very, very stable in tissue, so therefore solving one of the problems that had previously existed in prior formulations of ALA. And then ALA is covalently bonded, making it very stable. And then the key ingredients are really all there. So what is GlycoAla? It's a glycosphere that entraps 2% of aminolevulinic acid. And then it has this solid inner core, which is powerfully hydrophilic and biocompatible. The glycospheres have this single layer of fatty acids attached to the periphery. And then it helps to maintain the moisture by using hyaluronic acid. So as everybody knows, hyaluronic acid is naturally found in the skin, and it's absolutely used every day in my clinical practice in terms of using it to either make people look younger through topical applications of cosmeceuticals that we sell, or in another exciting approach, we actually inject hyaluronic acid into the face to help give that plumpness and lift. So hyaluronic acid in GlycoAla, it has the same sort of concept, really hydrating the skin to maintain moisture, aiding delivery, and helping to prevent post-treatment drying out of the skin or desiccation. So really, we're moisturizing while delivering the active ingredient. So the mechanism of action, this is so important. GlycoAla is a cosmetic gel that encapsulates the light-activated ingredients, that 5-ALA, in the glycosphere. And then the photoactive ingredient actually gets taken up by the cell, that precursor, the ALA, and converted into protoporphyrin 9. And that happens within the cell. And then when exposed to light, visible light, this protoporphyrin 9 converts to reactive oxygen species, free radicals within the cell. The main free radical is singlet oxygen. And then what happens when you have this buildup of the free radicals within the cells is that you have selective reduction, selective apoptosis of the skin cells that actually helps promote a younger, healthier looking skin. And that triggers this inflammatory cascade of reactions within the tissues, helping to improve the appearance of pore size, skin tone, and skin firmness. I have to share with you something extremely exciting. My clinical research trials team recently actually did a study looking at even, younger patients, the millennial generation. And, everything is about millennials now. A lot of people think that only people who are like myself, a little bit older, want to look their best. But that's absolutely not true. Everyone wants to look their best, especially millennials who are taking photos and selfies all day long. So what we did is we thought, this is the ideal treatment for people of any age, a little bit more seasoned people and even younger people who want to look great. And let's study this and let's take a look in our clinical trials unit and see if people who are, ages 20 to 40 can get benefit from using this procedure. And it was so interesting. We were able to actually show and demonstrate improvement in the skin on all different metrics. And we presented that data at the American Society for Dermatologic Surgery. It was phenomenal. It was really well received. It was a podium presentation. And this is groundbreaking that we're able to use GlycoAla to benefit skin types for skin improvement of all ages, which is phenomenal. So the hyaluronic acid, again, this is a complementary star. It really helps moisturize that skin, lock in the moisturization. And what I like to tell patients is that you're healing as you're being treated. And patients love that concept. They like to think, hey, how can I get a jump start on my healing? Well, this product actually includes the healing agent in the treatment agent. And that is so unique. So what does this really kind of show? Again, that the buildup from a mechanistic standpoint of this 5-ALA in the cells converts to protoporphyrin IX. It gets activated by visible light. Here we're showing red light, and then that creates these reactive oxygen species. And again, it's very important to use a visible light source that can activate this agent. That's where you get the photodynamic therapy. This combination of a topical agent, a topical treatment, plus a light-based treatment. And that's what's so exciting. And that's one of the things that, patients love it when you're on the cutting edge of, skincare, when you're on the cutting edge of treatments, when you have the most up-to-date technology in your hands to be able to provide them the best treatments, the newest treatments, and the most effective and safest treatments. And that's really what we have here. And that's one of the things that's incredibly exciting. That's one of the things that my patients love is when they come in, they know that they're getting what's new and hot versus what's a little older and not what's really on the cutting edge. So that really kind of takes us back to GlycoAla. And GlycoAla is the world's only light-activated cosmetic gel that includes hyaluronic acid and utilizes an advanced glycosphere nanoparticle delivery system for superior stability, absorption, and results. It's highly effective with minimal downtime and minimal risk. I do let patients know that they may be a little sensitive to light after the treatment. It's always good to do it a little bit more towards the end of the day when they're winding down, or make sure that they use sun protection when they leave. I love mineral sunscreens that work very well. Those are physical blockers. And I also like to recommend that they come in to the office with a broad brimmed hat. If they don't have a hat, sometimes we have some on hand to provide them. Or if there's a little mall nearby or a store nearby, we let them just pop out, go get that, and come right back. GlycoAla helps to enhance skin tone appearance, reduce visible signs of sun damage and aging, visibly reduce the look of pores, reduces the appearance of oiliness, promotes hydration, and improves the effects of moisture retention. And that last part I really want to emphasize. Again, our skin is comprised of several layers, and especially when you're talking about hyaluronic acid, because that's such a larger particle, that usually sits right there on the top of the skin, and it helps moisturize the stratum corneum and the epidermis. And hydrating those two layers of the skin help provide a nice glow to the skin versus that dry, dull appearance. And patients always want to have that shine, that shimmer, without looking oily. And so that's one of the other things that I really love about this product is it really helps give that nice Hollywood glow or that New York City look without being overdone or greasy or overplumped. So why choose GlycoAla? It delivers impressive results without the downtime, without the side effects and the cost typically associated with more aggressive treatments. Now, I'll share with you, I work in New York City, and people here have various price ranges that they feel comfortable paying for cosmetic treatments. But I'll tell you one thing, everyone loves a good deal. Everyone loves a bargain. And when they're thinking about spending, $1,500 on a laser treatment versus, a more moderate price point with a GlycoAla PDT session, a lot of times patients really think, well, how can I get the best results that's cost effective, safe and effective, and that meets all of their needs? And this is really a winner. It's ideal for patients who are seeking a treatment that provides a more dramatic, long-lasting improvement than superficial or moderate chemical peels, and they're not ready for the downtime of those peels as well. I'll tell you a story. One time I had a friend of mine, she was a board-certified dermatologist, and she had a patient. She came in for a procedure, and she had a chemical peel done. The patient called back a few days later, and she wasn't too happy. And the doctor said, "What's wrong?" And the patient said, "Well, my skin's falling off. My skin's peeling." And the doctor said, "Well, what do you think is going to happen with the peel?" And the patient said, "Oh, I never put two and two together." Most patients don't want that downtime of their skin flaking off. Most people have meetings, they have work, they have their social life, they're busy. They want a treatment that's going to give them a great result without those side effects of peeling and flaking and everything else associated with some of the more invasive procedures we do. I will share with you, this procedure will never replace a CO2 resurfacing, which is something that I specialize in as well. But again, those are for much more dramatic needs, and really, it's not every single patient. So patient selection is very important, and setting the right expectations. And that's something that we're going to speak a little bit more about once we start getting to some of our really exciting clinical photos to share with you. So again, we've kind of talked about the benefits of hyaluronic acid. It helps promote this hydrated look and skin softness without that oiliness. It gives a dewy look.
Hi, Dr. Jagdeo. This is
Hi,
Inge. I
I'm
think
here.
your audio went.
I'm here. I was saying about positioning. Did everybody hear the start of that? Okay,
No, we
perfect.
missed that.
Okay, so again, you want to really properly position the GlycoAla treatment. You want to make sure that you set the right expectations so that patients know what to expect, and that you provide them with clear and consistent outcomes that they can expect, and that they will be happy. One thing is I always like to under promise, over deliver, and by letting them know that this is going to be a cosmetic treatment with low downtime, but low downtime is correlated with more moderate results. Again, on the right with the microneedling and ablative technologies and Fraxel, it's not going to be to that level. But I do like to compare it to something that's better than microdermabrasion, better than mild to moderate peels. And, really, this is something that's very special, that is great for people who are on the go, who want to get that better look without a more invasive technology. So now getting to the second part of the talk, how do we actually activate GlycoAla? Will any light source do? Well, technically, yes, if it matches the activation peaks of the photosensitizer 5-ALA. So let's take a look. There are really two main peaks. There's one at around the 400 to 420 range, which is in the blue light. And then there's one peak that's over in the 633, centered around there. And, it's really important because that's what, protoporphyrin 9 is really activated by, those peaks. And, how do we value light and our light sources when selecting PDT? So we want to take a look at the spectral output of the light source. And then we want to make sure that that corresponds to the photosensitizer or chromophore. As we mentioned around 400 to 420, SITS 33 to SITS 35, so blue light and red light mainly. And then what's the differences? So as you increase the wavelength, going from blue to red, you have increased depth of tissue penetration. And the nice thing is that in the red light range, you're able to really penetrate several millimeters all the way down to subcutaneous fat. And that means that you're treating the epidermis and the papillary dermis, which is the top layer of the dermis, and the reticular deep dermis. And that is what's so exciting and what's different from using blue light, which really penetrates, about a little bit more than half a millimeter, which is really treating the epidermis and just the superficial layer of the papillary dermis. And so red light really is fantastic for aesthetic applications when you're thinking about treating the entirety of the dermis, and that's really where the powerhouse of skin renewal happens with those fibroblast cells that are in the dermis. That's really where you really want to treat. And LEDs are an incredibly effective light source for photoactivation and for treatment. And so what should we look for in a light source? We want to look for light sources that are clinically proven, that have the intensities or power densities to deliver the doses of narrowband light that we want. That is so important. And we want devices that have the ability to flex, to treat curved areas of the body. My face is curved and rounded. It's a three-dimensional structure. It's not two-dimensional, which would be flat. And we want a light source that has a three-dimensional ability and capability to flex to that need. Large enough, you want to be able to treat the entire face at once, or the entire area that you're treating at once without requiring multiple treatments. You want LEDs that are closely packed to reduce cold spots, which are untreated areas. Red light, SITS 33 nanometers. You want the correct dose of energy to be delivered. That's 37 joules per centimeter squared over any given amount of time duration. And then these are kind of what the light sources are. When you're able to flex these light panels, you're able to treat from multiple angles and get a better treatment area. So these are really positioned as in-office treatments. Most patients don't have these flexible panels at home. Some of them do have the little handheld units as shown on the left. They could spend a whole afternoon trying to use those handhelds to treat the entire face versus just one treatment session using one of the panels on the right. And then again, different head configurations. There are different devices out there. The LightStim, Poly, as we see here, the Poly device is very, very nicely designed, very nice U-shape, flexible, looks great in your practice, and it's floor standing. The OmniLux device on the right, there's a bunch of different heads. That is, historically the tried and true, Rolls Royce of LED units on the market. I can share with you that I've done studies with their devices over the past decade plus, and wow, there isn't another device quite like it. I'll just say that. One difference between that device and these other two devices, the LightStim and the Poly device, is that it's table mounted. So one of the things that people need to take into account in their practice is, do you want a floor mounted or table mounted device? Sometimes those things, do come into account. And then, what are some new light sources? What are some things that are super exciting out there? A lot of people have heard about these LED face masks. And one thing that really has kind of come out recently is this incredible OmniLux Contour silicone-based LED face mask that allows the active treatment area of the head to wrap around the entire face, ensuring the complete activation of the photoactive product, and effective light dosing is achieved in as little as 20 minutes, which is just, this is just phenomenal. I've been waiting a long time for something as beautifully and elegantly designed as this, and I'm so happy to have my hands on one of these and just have it in my laboratory. As the director of photomedicine at State University of New York, we're just absolutely pleased to be able to have this technology and be able to study it and utilize it and make sure that it performs the way that the company says that it does. It's very, very exciting. This is really, groundbreaking technology here. what is the GlycoAla protocol and how do we use it? How do we implement this in our own clinic to ensure that we get the best results? So best results are usually seen with 3 treatments spaced apart by 4 weeks. Before performing a GlycoAla treatment, you want to identify the client's Fitzpatrick skin type and the degree of photo damage. There's a different pre-treatment protocol for Fitzpatrick skin types 1 to 3 and 4 to 6. So how do I simplify this? You know, I really simplify this by breaking it down. I don't really love the Fitzpatrick nomenclature because that really is more about tanning and it's not as applicable to cosmetic treatments. And one of the things that we actually did when I was at the University of California, I was there for 7 years at UC Davis and studying photobiology and LEDs and treating patients with lasers, light, and doing photodynamic therapy on a regular basis for our patients. One of the things that we studied was we had NIH funding to do several clinical trials to identify the differences in the way that patients respond to LED lights. And this was super exciting because what we actually found is that there's differential safety that's based on not really skin type per se, but more so if someone is Caucasian, which is really Fitzpatrick skin types 1 to 3, and non-Caucasian, and which is usually 4 to 6. And that's really just an easier way to kind of break it down and consider your patients. So Caucasian as one protocol, non-Caucasian as the other protocol. And then before performing a GlycoAla treatment, it's important to identify basically their degree of photo damage and their skin type in your client's skin. And then this is the classical Fitzpatrick skin types breakdown. But again, I usually just group 1 to 3 as Caucasian, and then non-Caucasian I treat within the 4 to 6 protocol range. And then skin prep, 1 to 3 with mild photo damage. No advanced skin preparation is necessary. With severe photo damage, basically you want to use an alpha hydroxy acid cream 2 weeks prior, along with a sal acid wash or gentle cleanser, really to kind of exfoliate the superficial stratum corneum and any of the epidermis that may easily come off and prevent the optimal utilization of the GlycoAla. And then with the darker skin types, you want to, again, kind of prep the skin with a sal acid or gentle cleanser and also use an alpha hydroxy acid cream. The other exciting thing is that if patients have hyperpigmentation, there's different protocols that you can consider. One of the things I don't do is I try not to use hydroquinone in my patients. There are so many other approaches for skin pigmentation nowadays. We really just had a paper that just came out November 1st in the Journal of Drugs and Dermatology on the new treatments for melasma, which is super exciting. All of them really are trending away from hydroquinone, and there's so many exciting things out there on the market now. I really encourage everybody to take a look at that paper. Sensitive skin is really, really important. You want to use a gentle cleanser and a mild exfoliator. Patients who are on retinols or retinoic acid or retinoids, I really like to recommend that they try and discontinue this at least a week prior to undergoing the treatment. As we know, retinoic acid based products, retinoids, retinols, make patients' skin much more sensitive due to the mechanism of action of those treatments, which is making the skin much more permeabilized, increasing transepidermal water loss, and also leading to increased epidermal skin cell renewal and dryness as well. So that's super important. Really hold off on these treatments at least 5 days prior, but it'd be nice a week to 2 weeks prior. And then treatment protocol. Exfoliate with the GlycoAla oxygen scrub to allow for maximum penetration. Initiate a little mild redness. You want people to seem a little pink right after doing this. And then you want to make sure you have the lights down so that you're not activating the GlycoAla while it's being applied or incubating on the skin. You apply it about 1 to 2 mLs, 1.5 to 2 mLs of the GlycoAla with a brush and massage into the treatment area for about 3 minutes. Basically, the way that you think about this is that you apply just a thin film onto the skin, the areas that you want to treat. You leave it on for 40 minutes. That allows for the penetration of these glycospheres containing the ALA into the skin of interest. And then you want to remove any remaining GlycoAla at the end of that 40 minutes with water and just cotton pads. It's very simple. Then now comes to the photodynamic portion. You want to illuminate the skin with a low level LED red light source. You want to do 37 joules per centimeter squared. If people have any questions with regards to their specific devices, with regards to how long that is, please ask your representation and your reps so that they can help you with that. And then post-treatment, you want to apply an intensive moisturizing cream or like a vitamin A, C, or E oil. And then again, sunscreen, 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 and or sun protective clothing, hat, or any clothing cover up where you just got treated. So again, this takes us into the clinical portion here, taking a really close look at kind of what sort of results can you expect. Again, you know, we see baseline, we see some blemishes, some modeling, you know, just kind of a duller look to this wonderful lady. And then a month post the treatment course, you see noticeable improvement, total, you know, almost total disappearance of these, like, you know, freckles. A lot of patients come in and see me as a side note, and they say, oh, I have these sun freckles. I let them know that those aren't sun freckles. Those are little signs of sun damage that we can correct and we can help fix. And there are so many ways to do it, but no way has the same amount of gentleness combined with the same amount of efficacy as the GlycoAla PDT. Subject 2. So this is, you know, this is more often, you know, the classic patient who comes in and they say, you know, I want to look better. I say, well, what would you like to do? I said, I don't know, but I want to look better. I feel great. I'm happy. I'm living a full life. I just, you know, I don't look as good as I feel. And I like to say, well, there's several things we can do. And I run down the list. I let them know. And you know, one of the things I let them know is, you know, we can do cosmetic PDT, GlycoAla PDT to help you look better. And, you know, as we see here, the photos where the patient is wearing her gray shirt, she has some skin laxity, kind of a blander skin tone, and doesn't really have the sort of volume that you would want. And then 30 days after the last treatment in this striped shirt, we see that she's looking fantastic, a little less skin laxity. I mean, this is an amazing result. So patients can be very, very happy with results that really yield meaningful and demonstrable clinical improvement. Here's another patient, typical client, comes in, about 40-year-old lady, says, you know, I want to look better. You know, I'm a little tired. I've been in a lot of board meetings. You know, I've been traveling a lot, you know, living an active life. I've been playing tennis outside, and you know, I want to look better. What can I do? And, you know, so then you say, well, what are your concerns? What's really bothering you? At this point is when I usually hand the patient the mirror, and I say, well, what would you like? And so they, you know, they usually point out the uneven tone and texture, the redness, some of the blotches, some of the fine lines and wrinkles. And, you know, they say, and I want to be able to accomplish improvement in all of these areas with just one treatment modality. And I want to do it on a budget. So, you know, patients always want to up that level of complexity for us because, you know, with a lady like this, it's very easy to spend $10,000 making her look better, but you can also make her look better for under $2,000 as well. So, you know, patients always appreciate it when you outline all of the different treatment options and then let them know why one treatment is best for them. And most patients, again, want something that's affordable, effective, and safe. And GlycoAla PDT fills all of those needs. And so as we see here, before on the left, 30 days after on the right, note the improvement in overall skin complexion. We see a lot of the blemishes on the forehead are improved, on the cheeks. And then there's a reduction in pigmentation and there's a reduction in redness as well. She has a glow now. You know, does she still have some mild redness? Yes. Could she use a little filler? Yes. This product is best used in combination with a comprehensive rejuvenation approach for your patient. And there are things that we can really do for our patients that they really appreciate. And putting together a comprehensive plan where you're integrating GlycoAla into your treatment regimens, into your treatment therapeutics, into your treatment armamentarium to help give patients the best outcomes, that's really, that's a game changer, and that's a winner for them. Combining this, with the regular Botox regimen, with the regular filler regimen, with any other treatments that you're doing, really helps them achieve their peak outcomes. This is another lady around 42 years old coming in saying, hey, I have a little bit of crepiness under the eye. Under the eye is such a tough clinical site. I don't love doing filler under the eye because sometimes it can make patients look a little overdone. And here in New York, a lot of my patients say, I don't want that overdone look. I don't want that LA look. When I used to work in California, everyone wanted the LA look. But in New York, where people are more understated, they want the New York look. They want to look refreshed. They want to look rested without looking done. And, I love to be able to offer them something that can really help them without having to place filler under the eye, because that's a little bit of a danger zone. And it's a concerning area because sometimes it looks better, but sometimes, depending on patient selection, it may not yield the look that they're going for. And it may result in a little puffiness, a little swell, but patients usually want less wrinkles, a little less puffiness, and they just want to look refreshed. And this is an example of this patient. On the left, again, her before, and on the right, the after. As you see on the right, her skin is just glowing. She has improvement of her wrinkles underneath her eyes, some of the brown spots, and then also take a look at the nasolabial folds. That's another area that's tougher. It's kind of tougher to treat, with the exception of using filler. And again, I don't love putting filler in the nasolabial folds because it yields kind of that fuller face. It does get rid of the wrinkle, but it's not the exact look that patients are going for. I like patients to look natural. I like them to look their best. And GlycoAla helps them get there. I mean, GlycoAla is just phenomenal in terms of, even look at the crow's feet. Look at the improvement there. So again, another happy patient with a great outcome. The neck. Oh my goodness. The neck and the chest. This is another tough area because, classically, resurfacing on the neck and chest, it doesn't have a lot of adnexal structures. It's it's a sensitive area. It's a danger zone. IPL, oh my goodness, I've had patients come in and see me. They've gone to see others in the New York City area, and they had IPL done on the neck and chest, and unfortunately, the fluence was a little high, or patient selection, etc., and they've had not the outcomes that they were looking for in that area. And I like patients when they're happy. I like them when they're happy. Having patients who are unhappy it just makes our lives a little bit more complex. And when patients are happy, I'm happy. And I love giving patients great results to help their areas of cosmetic need. And I've read a lot and seen a lot of people, no matter what the age. A lot of times people think, oh, necks, that's, you have to be over 50 to need treatment for your neck. I'm seeing patients as young as 25 coming into my practice saying, oh, I have these lines on my neck. What can I do to make it better? And even in New York, it's not California. We still have a lot of tech people and, that whole tech neck concept where they have these horizontal lines and they want them to look better and they want to know what they can do. With regards to the chest, the crepiness and the aging and the sun damage that happens in people who have really enjoyed and lived full lives and want to continue living full lives, but they want their skin that's exposed to look young and look vivacious. It's very tough to treat that area, and I'm so thrilled that GlycoAla PDT is able to really step in and fill that need area and that need treatment for the neck and for the chest. Taking a look here on the left, 30 days before On the right, 30 days after the last treatment, and that improvement is absolutely stunning and phenomenal. I wish CO2 could give such a great treatment. And again, noting the improvement in overall skin complexion, the textural changes, and just the overall clarity of the skin is just phenomenal. I would say that just by treating the neck alone and the chest, this patient's skin is looking at least 10 to 15 years younger. And that's just a win-win for everybody. And again, I love happy patients. Again, neck and chest, taking a look at this beautiful patient who came in. This is someone who is living a great, fantastic life and just really, enjoyed the sun and enjoyed traveling and just everything you could do outside. And this Californian woman, she had some aging of the chest and she wanted to look better. And this is really an example of a lady who's young lady in her low 50s, and she wanted to, make this area look improved. And with a couple of treatments, taking a look at her baseline on the left and 30 days after her last session on the right, you can see a dramatic improvement in cleavage wrinkles, textural improvements in the skin, visible reduction in pigmentation. Now, again, I will always position this properly with my patients and with my clients, and I let them know that this is an improvement that we're going to be able to show you. It's going to be visible. It's going to be noticeable. This is not a CO2 resurfacing. This is not a deep chemical peel, but it also doesn't have the cost associated or the risks associated of scarring, of downtime, of redness, of swelling. And it doesn't have that, it doesn't have that dreaded downtime. So again, happy patients make me happy. Taking a look at the hands, another tough area. What can we do for hands? There's a saying out there that the hands really are how you can tell the age of a beautiful person. And when you look at their hands, you could see, especially some of the sunspots, the pigmentation, the roughness, the texture, the tone, the ruddiness here on the top, and then taking a look on the bottom. What a dramatic improvement. Have all of the spots faded? No. Are they completely gone? No. But really, overall improvement of the skin complexion, the textural changes, and the marked reduction in the pigmentation is dramatic. Let's take a look at pores and skin redness. So pore size is something that, again, my younger clients, they come in, they say, what can I do? I want to have that Instagram ready look. I want to have, that perfect skin. And, they want to know, what can they do? And I oftentimes let them know that pore size really gives away a lot of someone's age and also kind of betrays them on social media when they're taking their selfies and posting them. Because, the glossiest looks have the smallest pore size. And by using GlycoAla to help reduce pore size, that really is a way to get better looking skin. And then also the redness. The redness can be associated with different skin concerns, but they all kind of manifest the same with this red, ruddy look. And, by showing here by this visual analysis with computer-aided imaging, we can show and demonstrate really an objective improvement after a single GlycoAla session 30 days later in redness and, again, pore size. And this is really, really, a home run for patients who are trying to look their best and want to look their best in a quick, safe, and effective manner. Again, this is just showing, again, improvement in pore size. It's very hard to improve pore size, and having the ability to do that is just a home run. So let's kind of compare GlycoAla versus the competition, Alumera. So GlycoAla is a 2% encapsulated in a glycosphere. Alumera is less than 1% of hexaaminolevolanic acid. And then GlycoAla is developed to maximize absorption of the photosensitizer through the skin. The competition does not. GlycoAla features rapid absorption compared to non-glycosphere-based products. Alumera has a much slower absorption, It doesn't have this glycosphere exciting technology, and that really makes a big, big, big difference. GlycoAla requires 40 minutes of contact time versus Alumera requires 50% more time. You know, one of the things about my patients, they hate waiting. They want everything now. And, you know, by making them wait an extra 50% of the time, that it's a deal breaker for some. GlycoAla is specifically and specially formulated using hyaluronic acid to help increase healing post-treatment and water retention. Alumera has none of that. And then GlycoAla requires no mixing at all. You use the product, you're able to put it right on the skin, which I love. No mixing is required. And then Alumera requires us to basically set up our own little chemistry experiment in office, and it requires some mixing. And any excess can't be used again. Once it's mixed, it's done. So GlycoAla, you can take out how much you want, and you can use how much you want, which is, you know, I like ease and convenience, and that's one of the things that I love about GlycoAla. And now, how much does it cost per, you know, $70 cost per treatment? Alumera is $130 cost per treatment. So again, 50% savings with the GlycoAla. In summary, why should we use GlycoAla? Two main active ingredients, the GlycoAla spheres with the ALA plus the hyaluronic acid, shorter incubation times. Remember, 50% shorter time compared to the Alumera, better outcomes, no mixing is required, excellent return on investment, profitable, sustainable business model from day one, easy to add to practice. It's, you know, it doesn't really take a lot of extra effort or investment on your side. And then it's, you know, a comprehensive treatment guidelines and protocols and marketing materials and a website are all available, combined with unparalleled customer support, which really makes this very special. You know, one of the things that I like to invest in when I'm considering my devices, my treatments, my, you know, the things I offer in my practice are the people behind the products. And, you know, the people who stand behind GlycoAla really are special people. I've had the pleasure of working with them on a long-term basis. And this is really just something very unique. And they're very dedicated to customer support and patient outcomes and patient satisfaction and patient safety. So without any further ado, I'm ready to open it up to some questions. I wanted to thank everybody for, you know, being part of this. This was a very, very special webinar here. You know, we got really to take a deep dive into some of the clinical data, the science. We got to talk about what makes this product, GlycoAla, unique and special and positions well in my practice and hopefully your practices as well. And, you know, how this can really, really, really help patients to achieve their desired goals and their desired endpoints with very little downtime and an optimal amount of safety and efficacy. So without any further ado, I'm going to turn it over to questions. Thank you.
Thank you so much. And we do have a number of questions that have come in. I just want to let everyone know, if for any reason we don't get to your question, we will follow up with you after the webinar. And if you want to go back to view this again or to share with any of your colleagues, it will be available later today at medestheticsmag.com/webinar. So we did have a question asking if this can be used on active acne-prone skin.
So, I mean, the answer is mixed. It depends on how active. If someone is completely broken out and has a skin infection and is actively leaking pus, I don't think that that's the right choice for them. I think the right choice is for the patient to go see their board-certified dermatologist to seek treatment in a pharmacologic manner. If someone has one pimple or two pimples, if someone has a resolving acne lesion, absolutely. I can share with you from personal experience that I have treated patients in my, you know, at my clinical institution who have had, you know, ongoing acne and challenges with acne. And one of the photos that, you know, we presented at the American Society of Dermatologic Surgery is actually just such a photo of a younger patient, late 20s, early 30s, who had a couple of acne lesions, underwent this treatment, and they had improvement that they were happy with. And, you know, patient reported outcomes are so incredibly important in terms of the way that we assess devices and assess treatments, because, again, it's not what is meaningful to us, it's what's meaningful to the patient. So for patients who have ongoing acne, any sort of improvement that makes a difference, that's visible, noticeable, improves their skin, is a home run to them and to me.
Very true. And we had another question asking about, are there any contraindications, or have you ever had a patient experience an allergic reaction to the topical?
So I haven't had anyone experience an allergic reaction. However, there's, with all these allergies and sensitivities out there, there's always a chance that someone may possibly experience some sort of reaction. If you note that someone has a reaction, please go through your allergic reaction protocols in office, whether or not that involves an EpiPen or ice packs or, a Tylenol and an antihistamine. Whatever your protocol is, please implement that right away. And if it's severe enough, please send them to their nearest emergency room. Again, I haven't ever had this experience and I haven't ever heard of it, but anything is possible when dealing with, any sort of treatment. And that is very, very important. Any other portions of that question that I did not answer?
No, I think that, well, there was a question of, are there any contraindications in terms of patients
So
for
for
whom this may not be the
contraindications, anyone who has photosensitivities to visible light, red light, blue light, any sort of visible light, they would know. Anyone who has porphyrias, photosensitizing medications that they may be on, tetracycline class antibiotics, St. John's wort, those sorts of things may be possible contraindications. Please use your professional medical judgment when administering this treatment. Do a full review of systems, do a full past medical history, and please do a full check of their allergies and their medications that they're on. And if they're on any photosensitizing medications, please be aware of that and consider holding the treatment until they have completed their course of their photosensitizing medication. Most medications that are photosensitizing are only used in temporary manner. They're not used for long-term ongoing treatment. So, it's usually a quick fix.
Great. And we had a question about, if you have a patient, you're treating both the face and the neck and the chest area, can you do this all at once? Or is that a safety issue, or is it mainly limited by your light device and how much you can cover at once?
So that's a great question. You can only really cover one area at a time. You can treat two areas at a time. Just realize that the patient may have a little bit more swelling than the standard treatment. It's just going to take them a little more time and you a little more time.
And we had a safety question relating to pregnant women or breastfeeding. Would you not recommend this?
So anyone who's pregnant or breastfeeding does not receive any, cosmetic treatment in my clinical center. So I would advise against anyone who's pregnant or breastfeeding.
And you talked about skin sensitivity. What do you think about treating patients with rosacea?
I think that it can be beneficial. Just realize that rosacea is a medical condition that is easily exacerbated by a wide variety of exposures to a variety of things. So by doing this treatment, you can make someone's skin with rosacea better, because rosacea is commonly treated by light and light-based technologies. However, there's always a chance that they may be slightly sensitive to this treatment and they may have a little bit of redness, but that should resolve soon after the treatment is completed. Usually the redness resolves within a day or two.
Wonderful. And we're going to do one more question. Then, as I mentioned, we'll follow up with anyone we haven't gotten to yet. There was a question: if you have a patient who's had Botox or fillers or threads, do you need to wait to perform GlycoAla, or can that be done right away?
So there's, a difference of opinions out there. I usually like to recommend waiting at least a week or two afterwards. With Botox, with threading is a much more invasive swelling sort of modality. I would also wait for about 2 weeks on that. And then the With regards to fillers, there was a recent study showing that fillers with microneedling, the filler is not, interfered with by doing the process on the same day. So you'd probably do fillers on the same day. With Botox, I would wait, just because the way that Botox works is it's a wrinkle relaxing neuromodulator that is a protein-based treatment that is susceptible to degradation by inflammation caused um, by GlycoAla PDT. So you may want to hold off on that. Although I've heard from other people, colleagues, that they just do their Botox the same day and it's fine. One thing I do want to share is that the way I approach it is I usually do their Botox first, or their wrinkle relaxers first. And then I say I always love to follow up with my patients, and 2 weeks later for a complimentary follow-up and touch up if needed. And on that day, if you don't end up doing the touch-up, that would be the perfect time to have your GlycoAla treatment that day. But I always follow up my patients post Botox just to make sure that they're looking great and that they're happy.
Terrific. Well, this has been a fabulous webinar. We so appreciate you taking the time with us, Dr. Jagdeo, and thank you so much for all of you for joining us.
Thank you. Thank you.
Thank you. Have a good afternoon.